we will discuss the importance of regular tests to monitor MGUS, a condition that has a small chance of progressing to a more serious disorder, such as multiple myeloma.
Since MGUS is usually asymptomatic, periodic lab tests are the main way to detect any progression early. Everyone diagnosed with MGUS should have an initial follow-up about 6 months after diagnosis. At this visit, blood tests help establish a baseline and check for any changes. These tests include serum protein electrophoresis, SPEP, to measure M protein, which indicates abnormal proteins produced by plasma cells. Another test, called the serum-free light chain FLC assay, measures certain protein fragments that may suggest a shift in disease activity. In addition to these specific tests, a complete blood count, CBC, can help identify anemia or other blood changes, and measurements of creatinine and serum calcium check kidney health and calcium levels, both of which can signal disease progression if elevated.
If these tests show no significant changes, further follow-up is scheduled according to each person's risk level.
For those at low risk, such as those with IgG-MGUS with low M protein levels and a normal FLC ratio, follow-up lab work may be done every 2 to 3 years. For individuals at moderate or higher risk, annual follow-ups are typically advised to closely monitor for any early signs of progression. In cases where MGUS is considered high risk, either due to high levels of M protein or non-IgG types of MGUS, more frequent follow-ups are sometimes recommended. Additional tests may be used if specific concerns arise, such as NT-proBNP and urine albumin testing to check for amyloidosis, a condition that can occasionally develop with MGUS, though these tests are not routinely necessary.
Besides regular lab tests, it is also important to monitor for specific symptoms known as red flags that could indicate disease progression.
If any of these signs occur, further evaluation with imaging or a bone marrow biopsy may be necessary. These symptoms include unexplained bone pain, fatigue, weight loss, night sweats, unexpected bleeding, or new neurological symptoms like numbness or tingling. Lab findings like a 50% rise in M protein or an abnormal FLC ratio also require close attention.
This risk-based approach allows us to monitor each person appropriately, aiming to catch progression early when needed, while reducing unnecessary tests for those less likely to progress.